The Way to Wellness, brought to you by OnePeak Medical.
Today on The Way to Wellness, we're joined by Loveleen Ahluwalia, family nurse practitioner at OnePeak Medical. Loveleen is here to help us make sense of what your body's trying to tell you and share simple, practical steps that you can take to start feeling better. Today, we're diving into heart health. Loveleen, thank you for joining me.
Thank you, Emily.
So why is monitoring heart health such an important part of primary care?
I think monitoring heart health is such an important part of what we do because our goal is early detection of disease and disease prevention. And so if we are doing different things to monitor and track heart risk and cardiovascular risk, we can make sure that we reduce the overall chances of stroke, heart disease, and all of those things, and make sure that people can have a good quality of life.
What diagnostic tests do you offer to patients to monitor heart health, and why do those matter for their overall health?
I think a lot of monitoring heart health is kind of behind the scenes. So when you come in and we check your blood pressure and we check your vitals or we take your weight, all of those things are screening tools. We check a lipid profile once a year at least, and that's screening for heart health. And then all of those things are just tools. And I think even just listening to the patient, understanding what your lifestyle looks like, what kinds of things are you eating, those are different tools.
And Loveleen, how does functional medicine combine lifestyle changes and medications to support heart and overall wellness?
I think functional medicine likes to take a look at the overall life that a person lives. So we're not just looking at you when you come in and looking at your vitals and saying, hey, like your blood pressure is really high, so you need to be on medicine. We also want to take into account what are the things that you are eating, how active are you, how stressful is your life, and use those different tools and optimize all of those things so that we can ensure that we are reducing your overall risk.
And Loveleen, what is one step that patients can take today to support their overall health?
I think all of those things that I mentioned, really when we talk about optimizing, ensuring that we're reducing your stress, we are managing your diet and making sure that you're having a really well-balanced diet, fueling your body with nutritious foods, and doing things to stay active.
Thank you for joining us.
Thank you.